Coming up, we'll be on location at Walker Plastic Surgery in Washington, D.C., discussing the latest advances in facial rejuvenation and body shaping and how they can help you achieve the look that you desire with one of this region's top plastic surgeons, Dr. Rondie Walker. Dr. Walker received her medical degree from the University of Washington in Seattle, Washington, and completed her training in head and neck surgery, general and plastic surgery from the following institutions: Yale University, Georgetown University, and Oxford Universities. Dr. Walker also completed her fellowship in craniofacial surgery from the renowned Dr. Marshak in Paris, France. Welcome, Dr. Walker. It's a pleasure having you on our program.
Thank you, Rocco. It's a pleasure to be here.
It's your first time, in fact, on the Top Doctors interviews.
Yes,
we have a lot to talk about. We're going to hear from some patients a bit later as well, but I wanted to begin, if I may, Dr. Walker, by asking you if you can please tell us about what some of the latest advances are in facial rejuvenation.
Well, sure. I'd be delighted to. Surgery is still the gold standard. I mean, if you're really going to get into the major things that need to be done. But what we found is that it's nice to start with the more minimal procedures, combine the procedures together, and actually start some of the procedures at a younger age, so that you're probably doing more little procedures over the course of a lifetime of a patient, but you're not just having hitting 65 and all of a sudden, boom, you're tight as a drum.
Okay.
Okay.
See, when you mention little procedures, like you're talking about the injectables and
right.
like Botox.
We're talking about I'm talking about Botox, I'm talking about and all the other neurotoxins such as Xeomin and Dysport, and then the injectables, of course, the standards being, Restylane, Juvederm, Volbella, which is now for the lips, Voluma, which is for the cheeks and parts of the face, Radiesse or Sculptura, which are heavier injectables. So what I find with my patients is that when they come in, I have to really assess, one, their age, what they are wanting to gain, what really bothers them the most. And if I see that what they're wanting and what I can provide is a mismatch, or that they're really looking at something that isn't what they should be looking at, I'll point that out to them. But, for example, we'll see a patient and they're young. Some people are starting Botox in their late 20s, even 30s. And it's preventive to a degree, because we get rid of the fine lines and wrinkles, or the wrinkles, deeper wrinkles, so you don't, raise your brows, raise your forehead and all this to develop the wrinkles over the course of time. So that's one of the things we do. And then usually the next step is people will start with fillers. Lip augmentation with fillers is very popular, more for females than males, I would say. And we have patients as young as 20 all the way up into their 30, 40, 50s. And I usually combine some of that procedure, but using the patient's own body fat when I'm doing facelifting procedures. So that's another option. But I think that the biggest thing with the newer things in facial rejuvenation is less is more, and smaller procedures over the course of a lifetime. So that seems to be, one of the mainstays, or one of the main ideas that's current in plastic surgery right now. We also have some other types of facelifts, which sounds sort of funny that you could have a non-surgical facelift, but we have what we call an Insta-lift or silhouette lift, where we're using polyglycactic threads. And I have an example here. This is a patient. Now, I did this patient's facelift probably 15 years ago or so, and she came back and was unhappy with a little bit of the jowling and whatnot that she had down here. Let me just point to it. So these little threads come here and here. These are the marks that we made prior to surgery, and they're put in through just one little tiny pinpoint, and then brought out and pulled out and then tightened up. So here she is immediately after, and here she is at about 30 days. So this is a totally painless procedure, except for the injection of a little bit of local. And patients can go out and have lunch, right after it's done. It really is a lunchtime facelift, or after lunch facelift. It is also one that will last about 18 months to 2 years, and it continues to tighten over the first 6 months of the procedure. So it's very ideal for a patient that's, say, in their 40s, maybe up to 55, depending on the age. But then when someone gets older, such as an example of a facelift patient, they have too much skin, too much laxity to be able to tighten it enough to get a result like this, which is a surgical result.
Okay.
So that's the difference. So we either use this procedure on people who've previously had surgery or people who are young enough or their skin is thick enough to have the surgery done, or the Instalift done.
Very interesting. And what I like about the Silhouette Instalift that you just showed a few moments back, this is something that the busy professionals in this area and folks out there can literally get, as you mentioned, Dr. Walker, during their lunchtime, sort of like a
Basically, yes,
lunchtime lift.
It is like a lunchtime
And there's
lift.
no downtime. They can go back to work,
Right.
and then they get results very quickly. And it's something, as you said, is really an ideal option for folks who don't want the surgical facelift,
Right.
which is a more traditional one.
Right, it is a nice option. It's just so you have to be the right type of candidate for that type of lift.
Yes. Now, what types of problems that are beyond the cosmetic area? The reason most people come for this type of a procedure or treatment is on the cosmetic side, but I also understand that there are some problems that some of your facial surgeries can correct and help people with as well?
Sure, if patients have Bell's palsy, for example,
Okay.
and usually Bell's palsy is by definition a seventh nerve paralysis that no one knows what the etiology is. And it usually just resolves on its own. So we call it Bell's palsy, but a lot of times people can have had an accident and injure their seventh nerve, which is, innervates the muscles to the face. So there are a lot of procedures we can do where we'll tighten that skin where it's down if a nerve anastomosis doesn't always work. Adding extra fat to a face, repairing and redoing scars, scar revisions, structural fat grafting to the face, a number of things like that we can do.
So you can help a wide range of folks out
We
there.
really can. We really can.
Now, is there any discomfort or downtime with some of the surgical options you mentioned?
Yes, there are. Certainly, if you're doing a full facelift or a rhinoplasty or any of those procedures, the patients are asleep in the hospital, unless we're doing a mini lift, and we can do a very mini facelift under local anesthesia. And that can be done here in the office with a nurse assisting and the patient being monitored. Those can be done, but the other surgeries are bigger and they require, somewhere between 2 to 3 weeks for recuperation, depending on what it is. Sometimes it's just 1 week.
Okay.
Like if we just did an eyelid surgery, upper eyelid, the patient would be fine to go anywhere and do anything after 48 hours, and maybe have a few sutures in and a little bruising for about a week, maybe.
Yes. Then they're on their way back.
Then they're on their way back. Correct.
All right, that's certainly good to know. Now, we saw the results obviously from the Silhouette Instalift.
Right.
And from the surgical facelift as well, from the pictures we saw a few minutes back. But I wanted to ask you, Dr. Walker, can you please tell us a little bit more about the results your patients are seeing from the various facial treatments?
Sure. Well, the thing is that when I do a surgical procedure, or even sometimes a non-invasive procedure combined with a surgical procedure, we'll have a variety of different things that are done. And this is an example of a patient, I showed you her before, that had, initially she came to see me for her nose. She had broken her nose as a child and she never liked her nose, and that was her initial visit to me. And her septum was very crooked, she couldn't breathe, and I also am trained in otolaryngology, head and neck surgery.
Oh, okay.
So I'm really an expert on noses.
Yes.
So I actually had to come in and open her nose under here, fix the entire nose, allow her to breathe, and as you can see, this is quite a nice result.
Absolutely.
The crook in the nose is gone, there's no hump in the nose, and the scar, even though this was done in an open technique, is not even visible. And she liked this so much that she came back and I did her blepharoplasty. You can see there's no scars.
Yeah, the eyes.
Right, the eyes. And I did a full facelift on her and neck and part of her brow. And also we injected fat into her cheeks, structural fat grafting, and fat into the patient's lips. So most of these surgeries that we do, for example, if I just say I'm going to do a facelift, I'm usually combining a lot of the other little non-invasive procedures or so-called non-invasive procedures with the bigger surgical procedure too.
See.
And I think that's the whole art of plastic surgery,
Yes.
is deciding what each person can benefit from, what will maximize, their appearance. I never, do one cut operation for every person.
I love the fact, Dr. Walker, that you combine and use in tandem your various options in the surgical and non-surgical arena that you offer here
Right.
based on each particular patient, his or her needs, and you customize those treatments accordingly
Right.
to really maximize their look and their
Exactly.
appearance.
Okay.
Now, I wanted to ask you, Dr. Walker, about follow-up visits. Are there follow-ups that you require from your patients, not only on the surgical side, which I think that would be the case,
Right.
but also for the folks on the non-surgical injectable side as well?
Yes, there's less follow-ups, obviously. A lot of people,
Yeah.
especially if they've had, Botox before, they don't need any follow-up.
Yeah.
But sometimes Botox can take up to 2 weeks to get a full working of the
Sure.
forehead. So patients sometimes will feel that they need to see it within 48 hours. And some patients do, some patients don't, because the absorption rates are different. So I always leave it open that people can call me and come back. If I feel that a patient has had a history, for example, of Botox causing a lid droop or something, which can happen. It doesn't usually, but it can. And if they tell me that, then I make them come back within a week so I can see how they're handling it. I'll put in less Botox to begin with, and then maybe add a little more down the road. Also, people tell me they have an allergy to fillers, or there's anything that is a little bit different than the usual patient, and the door is always open for them to come back.
That's certainly good to know as well.
Yeah.
Now, you mentioned earlier the Silhouette Instalift.
Right.
Is generally the results last up to about a year and a half or two.
Right, about
Now-
18 months to 2 years.
Now, what about as far as the actual surgical facelifts, the traditional surgical
Well, the surgical
facelifts? How long do
facelifts,
they last?
I mean, for an example, in this patient, her facelift is going to last her, I would say, from 7 to 10 years. I mean,
Oh.
she's really, she's done very well, and she's tightened up, not too tight, but, and the thing that really helps with it is the fat. So
Yes.
as she starts to, gravity starts to take over again, she may come back. She won't need this bigger procedure done. We may just decide to put some more fat into her cheeks.
Okay.
And that is a small surgical procedure. And we may decide to just do either an Instalift or a little tighten up mini lift, because she already has the incisions that we can just use again, so there's no additional scarring.
Very interesting. And Dr. Walker, looking at some of these pictures and seeing some of your patients and the work you've done over the years, it's very impressive in the sense as well that when patients get a cosmetic treatment done, the last thing we want to do is look like we had a cosmetic treatment
That's exactly
done.
right.
These are very natural results. It really looks so natural that somebody didn't have anything done,
Right.
from what I'm seeing and
That's
hearing.
great. That's great. Thank you. I appreciate that. It's a nice compliment.
Dr. Walker, besides the cosmetic procedures that you provide and that you told us about today, what other types of treatments or procedures do you also offer for folks out there
Well,
who could benefit from them?
This is more in the reconstructive arena, but I never like to divide my work into cosmetic and reconstructive, because I think all the work gets treated
right.
as cosmetic work. But for example, if patients come in with skin cancers,
Okay.
and I work very closely with a Mohs surgeon, so one of the, they'll see the patient and they'll take off the lesion, and sometimes the patient can come in and they can have half their lip gone. And we'll have to do reconstructive procedures to advance tissues, advance flaps, and repair, for example, a lip or part of a nose that's missing. I also treat lacerations on children, fractured noses on children. We can do a lot of things with this: structural fat grafting, scar revisions. Just good plastic surgery that's done to take care of these defects.
Now, I also understand you offer body sculpting
Yes, I do.
procedures. Could you please tell us about those?
Sure. Most of the body sculpting procedures that I do are usually a combination of surgery and liposuction, or liposuction alone. It really depends on the reason the patient's having the procedure. Sometimes it's a mother who's had 3-4 children, and she comes in because she's not as tight as she used to be, and no matter how much she exercises, she can't lose the tummy or the excess skin on the tummy. So she might have put a little fat on her hips, and maybe there's a change in her breast shape. So we'll do things like breast reduction if necessary, or a mastopexy, which is just lifting of the breast, or sometimes combine a mastopexy with a breast augmentation. And at the same time do an abdominoplasty, which is a tightening of the tummy, and tightening of the muscles that get really splayed apart after having had a pregnancy. Also, in combining with that whole procedure would be liposuction. And that's generally called the mommy makeover. And then we have patients who will come in and they've had a great deal of weight loss. Not necessarily always a massive weight loss, although we have those patients as well, but a weight loss. And they just can't diet it off and exercise it off together. So we'll do a combination of, usually liposuction. Sometimes in men especially, we can end up doing the total belt lipectomy, or people who will need thigh lift, medial thigh lift. And I think one of the exciting things about some of the newer body sculpting procedures is that with the structural fat grafting, we can actually do buttock augmentation, breast augmentation using fat, if the patient has enough, fat in their body.
Sure.
But it has to be done in a series because you're not just putting in a straight implant. Each time patient's coming in, you're adding a little more fat, a little more fat, a little more fat. And you have to also take into account that some of that fat will reabsorb, and then you'll have to go back and put more, but it's kind of a layering approach till you get the patient, a little bit above where they want, and then brings them right down to the shape and the size of the breast that they would like.
And for these types of other procedures that you've just touched on, obviously the potential patient will contact you, you set up a consult, and then you customize a plan,
a treatment plan, because no patient is the same, and everybody's going to vary. So, and those big procedures like that are done always in the hospital.
Yes.
And patient usually spends a night or two in the hospital.
Now, we're literally out of time, Dr. Walker, but I wanted to ask you before we let you go, you and your practice, Walker Plastic Surgery here in Washington, D.C., have certainly established a reputation for excellence. You're not only recognized as one of this region's top plastic surgeons, you and your staff are really known for giving each of your patients that individual attention, and the results speak for themselves. And I just wanted to ask you what you feel helps separate you and your practice apart from any of the others.
I would say that we are a very small practice, really a boutique practice. And because we're small, we can really spend a lot of time with each patient. And every procedure that's done here, I do myself, except for maybe some of the smaller laser treatment procedures. The radio frequency laser, not the CO2 laser treatments are done. My esthetician does some of those, but all the injections, all the Botox, all the injectables are done by me. And all the patients here do see me. We're very small, and like I say, we're a boutique for plastic surgery.
Yes, indeed, and you're doing some great work, and you have been for many years. And on that note, we'd like to thank you, Dr. Walker, for joining us, being a guest on our program. We'd love to have you back on in the future.
Well, thank you. I would like that very much.
Thank you.